Welcome back to Crush Medical. We've got another high yield board exam question that students get stumped over all the time. So let's break it down one by one, okay? Make sure to like and subscribe. Help this channel grow so we can continue putting out more free content that's ultimately going to benefit you guys, okay? Check us out at crushmedical.com. I've got a free MCCQE1 fail-proof study guide that will help you not only pass on your first attempt, but score well, okay? I've also got a high yield Anki deck. It's one of my best sellers. A lot of students have bought that from me and done well, extremely well. So make sure to check that out. We also do have a flagship bundle, which is a premium service where we do everything from exam preparation to coaching to putting together your CaRMS, your MyERAS application, as well as interview mock sessions and guidance throughout the whole entire interview process. Okay, so check that out as well. Let's jump right into this high yield question. So we've got a 4-year-old boy who has a 2-day prodrome, a fever and runny nose, now with a noisy breathing. He is alert and well appearing with inspiratory stridor and suprasternal and supraclavicular indrawing. No drooling. No other abnormalities are noted. What is the most likely diagnosis? So this is a very high yield diagnosis and question, very textbook, very common, and of course one of the more frequently tested topics that students easily mess up. So let's go through this option A. Okay. So before we even go through the options, let's quickly go build a framework. So we have a child who's been dealing with 2 days of symptoms, right? Fever, runny nose, noisy breathing. He appears well and he seems alert, so that's a really assuring sign. That being said, he has a very important finding called inspiratory stridor, and along with that, they have suprasternal and supraclavicular indrawing. So this is very specific for one of these diagnoses, and we'll break it down now, okay? So option A, bacterial epiglottitis, this would be incorrect. And this is our first distractor, right? So bacterial, again, bacterial would imply that they would have at least a fever and a more toxic appearing clinical picture here. So they describe a child who's actually in a tripod posture, and that is how toxic and concerning bacterial epiglottitis would be, and it's borderline an acute concern to the point they sometimes might need intubation, okay? So that is something that is just not what we're seeing here in this patient. Um, Another high yield diagnosis to be aware of though, okay? So let's move on to option B, sudden aspiration of a foreign body. So this is another very high yield diagnosis and clinical question that examiners love, right? In this case though, this is just not it, right? And how would that present? They would say a child is actually playing under the table at like some kids party or is at the store and is now choking, right? Choking would be the clinical picture as to how these patients typically present. Choking and a noisy breathing. So in this case, suggested by an abrupt choking episode in a previously well child, not some viral URI type of situation. Um, we can say that choice B, sudden aspiration of foreign body, is incorrect, okay? Moving on to option C, which is viral croup. This is in fact the correct answer, right? So let's just quickly go over what the explanation is. So firstly, it's viral. Let's establish that. So we will have this viral prodrome plus an inspiratory stridor, very high yield and very specific, along with suprasternal and supraclavicular indrawing in an alert young child is classic croup, okay? Textbook, this is how we would always present. So again, few high yield bullets to just keep in the back of your mind. Inspiratory stridor for croup, you're going to see this. And why? It's because you get obstruction in the upper airway, right? So the subglottis region. So just be aware of that. Specifically, the subglottis is where the obstruction is, and that's why you get this inspiratory stridor. And outside of that, they actually look up they feel they look alert and they appear well, right? So that's really really reassuring because number one, if they're gasping for air, if they appear cyanotic, that's very alarming red flag signs that hey, this patient might need intubation or oxygen support, which is just not what we see in this patient. They're dealing with a cough and they're dealing with this noisy breathing, but it's not particularly emergent, okay? And of course, because it's a viral sickness, so you will have this viral prodrome. So you have this fever, coryza, and it's not this sudden event where they're just out of nowhere going to have severe symptoms. Okay, so they do have this viral clinical picture that we can kind of establish as part of their history. And quickly, we'll just go over the high yield exam tips. So alert child, viral prodrome, and now they have this inspiratory stridor. This is classic group, okay? A toxic drooling child who won't lie flat points to epiglottitis. So that is the main distractor and another high yield diagnosis to be aware of, okay? Let's just go over the last two options. We know they're incorrect. So bronchial asthma exacerbation, basically asthma itself. This would produce an expiratory wheezing, right? It wouldn't present with an inspiratory stridor with a viral prodrome. That's just not how asthma typically presents, right? And of course, expiratory wheeze, and that occurs from a lower airway obstruction, okay? And last but not least, we have the retropharyngeal abscess, which is an emergent concern. You're essentially having an abscess that's pulling in the back of your throat. That's very, very concerning. And that presents with a neck stiffness, dysphagia, and a toxic child. Not this clinical scenario where they have a viral prodrome and now they have a simple stridor, okay? So this is a very high yield question, relatively easy, but also very easy to get tripped up on, and very easy to fall for the distractors, bacterial epiglottitis, because the child is sick and people just might think it's something really, really acute and concerning. It's just goop, okay? So if you enjoyed this question, make sure to like and subscribe, and we'll see you in the next one.